Then we have the work of the WHO, right? So the World Health Organization, which we're all familiar with thanks to COVID, develops policies to assist countries to take action to promote health and well-being, monitors health and well-being and health and well-being trends, and conducts research in providing health and well-being information, and sets global norms and standards, and monitors their implementation. Okay, so they do lots and lots of different things, and you just need to be able to know one or two of the works of the WHO, what they actually do. Okay, and then we have the priorities of the WHO. So they address health emergencies, they build resilience in the event of outbreaks, right? They promote healthier populations, okay? And they achieve universal health coverage so that all people have access to health services without facing barriers. So what does achieving universal health coverage mean? Means that all people have access to quality healthcare facilities. So they address the service access and quality, the workforce, medicines, vaccines, health products, government, finance, health information, and systems. So the WHO is trying to aim to achieve all of this by addressing these specific things. Another priority is addressing health emergencies, right? And the main idea is that you can build resilience so that people in outbreaks have much more resilience, right? And then have access to life-saving services as well. Right, so the first part is to prevent those things from happening in the first place, prevent disasters happening, and the second is in the case of disasters, this is what needs to happen, right? Access to life-saving services. Then promoting healthier populations relates to improving human capital, preventing non-communicable diseases and promoting mental health, eradicating high-impact communicable diseases, tackling antimicrobial resistance because lots of antibiotics are no longer effective against popular really common bacteria, and then addressing the health effects of climate change in small island developing states and other vulnerable states, right? Because they're the ones most affected by climate change, even though high-income countries are the ones mainly contributing to it. Okay, so those are our three WHO priorities. So in this question from 2020, it asks you to identify and describe one WHO strategic priority reflected in the information. Okay, so you need to be able to use one example from the information here to support your response. So in this information, we have that 140,000 people died from measles. Okay, and the WHO basically tried to create a world without measles and rubella by increasing vaccination coverage, improving disease response, monitoring and evaluation, and building public confidence and demand for immunization. Okay, so think about the three WHO strategic priorities and have a go at answering this question by pausing the video. Alrighty, so here in this case, one of the main things you should be talking about is addressing health emergencies, okay? Because this is really, really important because when you have 140,000 people dying from measles, that's a health emergency, right? So the WHO priority, it helps individuals and communities recover from mass disease outbreak by supplying medical resources, right? The WHO showed leadership alongside the CDC to supply vaccinations and immunizations to treat community. The other thing you can link it to is promoting healthy populations. And then the other thing you could also talk about is achieving universal health coverage. Okay? Because what they were trying to do here is the WHO tried to provide vaccines to everyone to ensure that they had access to resources, right? To achieve universal health coverage.